not dissimilar to what you were saying when you had your injury. Even though it happens in one place, how much else is affected?
Yeah, it affects everything. You know, I had the injury, which really was a tearing of the muscle at the base of the spine on the left side, erector spinae, and then there's another muscle at the sacral area called multifidus. But you know, again,
love that name.
they all work together.
I might name my child multifidus.
And then it was carrying into my left thigh, which I'm still working on. I don't have what I would consider chronic pain anymore. I can train very, very hard. I can train consistently week to week and be sore. And then the chronically sensitive soft tissue left in my body, of course, aches. But I continue to gain ground on it daily because of the restorative techniques that I came up with just along the way as I started to kind of just go into initially the pain.
Sure.
And I started doing very small movement. And I could feel the sensation where it would travel and where it wouldn't. And I just did very small micro movement, and then I started learning more and more about circulation and the fact that the blood in our body, our heart is cardiac muscle. It's a pump, and it's contracting and relaxing, and it's moving on average 1,600 gallons, 1,600 gallons of blood every 24 hours.
It's a lot of blood.
That's more than 100 tanks of gasoline. So that's more gas than we typically use in an entire year in our car. And it's trying to push that blood, that fluid, through tubing systems and at the smallest level capillaries, which are microscopic.
Tiny little things.
Now, there's another factor called lymphatic fluid. That is our immune system. It's the garbage disposal. It doesn't have a heart to pump it. There's 3 times more lymph fluid in the body than blood. 3 times more, a lot more. It moves from the compression and release of muscle contraction a little bit by gravity, and also another factor, slide and glide within the musculature of the body, movement in the soft tissue. See, we orient from movement of a joint, but a joint won't move without the soft tissue moving, because that's what's limiting or allowing movement of a joint. So as you increase the slide surface within the muscle, the soft tissue, and then you gain mastery to use muscle contraction to squeeze and release the muscle or soft tissue, you actually start increasing the ability for lymph and blood to flow to and from cells in the body and get the bad stuff out and the good stuff in.
I feel the birth of M11 Fitness coming
There you go.
on.
That's the right there is the essence.
There it was.
That
Just
piece.
organic.